Mr. Speaker, a lot has been said about this bill. Myself, I was in the Assembly clinic watching the proceeding when Honorable from Edo raised to present this bill, and I feel I must come to make my contribution. Mr. Speaker, from the presentation of Nena and many other members, we need to appreciate the fact that the rate at which cancer is spreading in Nigeria is alarming. And this element has no face, it has no religion, it has no creed, and it has no status. And it is very sad, until today, medical practitioners are battling even to ascertain the cause of this element. In view of that, Mr. Speaker, I have only 3 points to make. The first one, Nena was really economical in her presentation with regard to national health insurance issue. In Nigeria today, the NHIS did not capture cancer as an element. It only captured malaria, child delivery, cholera, and many small petty ailments. But when you have cancer, you believe with your own family, or you believe with only your friends. Government has no business with cancer patients, even in the so much celebrated NHIS. So, Mr. Speaker, honorable colleagues, we must rise to our responsibility. We must review this act of NHIS and co-opt this issue of cancer and many other elements. That is one, Mr. Speaker. Second, apart from the issue of breast cancer, cancer as general has become an epidemic in Nigeria. Because, Mr. Speaker, let me share one information with you. In Nigeria, we have Center of Excellence with regard to treatment of cancers. Maybe at least 10 hospitals, teaching hospitals, were selected by federal government to serve as Center of Excellence. But if you go to those centers of excellence, even the machines are not working. I can vividly recall 4 months ago, patients in Lagos, because Lagos is one of the centers of excellence, were required to go to Sokoto for cancer therapy because the machines are not working. Until June this year, out of the 10 machines, only 6 are working. And even the 6 are outdated because they did not meet the standard, the current standard of cancer therapy machines. They are obsolete to some extent. Mr. Speaker, I think the committee, the National Assembly, both Senate and House of Reps, the Committee on Health, is a clarion call on us. Though we are doing our best, but this is a year for budget. Before the passage of this bill, we need to start something. Not to say until the bill is passed by the House before the government starts something. No, government, the executive is bringing the budgetary bill act very soon. So the Committee on Health, through their oversight function, need to identify how many machines are working, how many oncologists do we have even in Nigeria, and how many cases of cancer are reported in our health institutions. Because even the much celebrated 4 million, Mr. Speaker, is only for those who visit hospital. We still have people in villages who are yet even to be captured in the data because they find it very difficult to go to hospital because of low level of awareness. Because even in my village, until today, some people feel that it is not even wise when you have cancer to go to hospital. They say by the time they give you immunization, the ailment will get worsened. So, Mr. Speaker, we have a lot to do. Finally, honorable colleagues, I think in Nigeria we have National Cancer Center. But we need to ask ourselves, from the establishment of that National Cancer Center to today, is there anything worthy coming out from that center? If anything is coming from that center, then what we need to do is to empower that center again. And if the center is not meeting up to the demands of Nigeria, it is the responsibility of the House Committee on Health again to ascertain that and report back to the House, because it will also aid the House, the Assembly, to decide on the fate of this motion. I must congratulate the mover of the bill, because I think the bill is timely, because this is a very deadly disease, and we must act fast on it. Thank you, Mr. Speaker, for granting me this opportunity. Thank you very much, my honorable colleagues.
Honorable Dr. M.S.